In studio with us on the eve of Go Red for Women Heart Awareness Day is the head of the Cardiac Intensive Care Unit at Toledo Hospital, Dr. Gopinath Upamaka. Thank you so much for coming in today. We appreciate it.
Thanks for having me.
Now, Lucas County has made another not-so-nice list. Tell us about the state of heart health right here in the Toledo area.
Yeah, Laura, there's a good news, bad news scenario here. The bad news is that Lucas County residents at large have really a very high incidence of the risk factors for heart disease. Risk factors for heart disease are high blood pressure, diabetes, smoking, sedentary nature of activity, family history of heart disease, and diabetes, as I mentioned. In all of these things in Lucas County, we're at the highest incidence rate. So the prevalence of the risk factors is very high. And we've got a high prevalence of those risk factors that leads to a high incidence of heart disease.
Mm-hmm. Now, it sounds like some of these things you're talking about, other than family history, are things you can do something about.
That's right, and that's the good news part of it. While we have a challenge with obesity being at 70% of the population, either overweight or obesity, 70% of the population is in that range. We have a 25 to 30% diabetes and high blood pressure range, especially when you look at people who are 65, women especially with high incidence of diabetes and high blood pressure. So while we have that tremendous risk factor pool here, that gives us the opportunity to significantly impact on the incidence of these. We can treat high blood pressure effectively. We can treat diabetes effectively. We have novel and good approaches for smoking cessation. And we can exercise and eat a little better to try and get our weight back down to where it can be. And if you do all of those things, then we could be better than the national average when it comes to cardiovascular health and disease. So it gives us a tremendous opportunity, I think. And the American Heart Association, Toledo Hospital, we at ProMedica Heart and Vascular Institute are very proud to be able to present and highlight for this entire month of February heart health in general. And so I'd like your audience to be really proactive in taking care of some of those risk factors.
See this as an invitation to start making some of the changes?
Yes, it is. See a primary care physician and make sure that each of these risk factors is properly addressed and properly treated to target. Just taking a blood pressure pill doesn't really count. You've got to get it down to target. It's the same scenario with diabetes. You've got to get your A1C better. It's the same scenario with weight. You've got to get your weight down to where ideal body weight concerned. So it's not just okay to kind of say, well, I think I'm taking some medications, but you want to make sure that you really reach your goal when it comes to each one of these risk factors.
So some serious lifestyle changes, but for a much better and longer life.
I believe so. I think as long as whenever I counsel patients, they are very forthcoming in what their problems have been, and we can work through those problems, which limit them from achieving good heart health.
Well, thank you, Dr. Upamaka, for spending some time with us. That is tonight's Talk Back.